Good evening. Before I begin my talk, I'd like to share 3 words with you that I would like you to remember throughout my talk, later, tomorrow, and from this day forward. Those 3 words: compassion, dignity, and respect. Early one morning I awoke. I had extreme abdominal pains. I was vomiting, I was in a terrible sweat, and I ended up on the bathroom floor. An ambulance was called, and I was taken to a local hospital in the emergency room, and as I'm being wheeled in on a gurney, I can hear someone in the background say, "Put her in this bay." But as I'm being wheeled into that bay, I hear someone else call out, "Hey, she's a he. Now, where do you want us to put him?" Within moments, I realized this wasn't going to go well. My nurse refused to touch me. I didn't know why, but she wouldn't touch me. I was very, very cold still, and I asked her for a warm blanket. But she refused to give it to me. I asked multiple times, and finally, down the bay, I could hear in the curtained bays farther down the line, I heard a woman holler out, "Would you please get her a blanket?" Well, a little time passes, my curtain opens up, and there's the nurse. She has a blanket. Okay. She didn't cover me with it. She didn't hand it to me. She didn't even lay it on the foot of the bed. Rather, she threw it at me. I didn't know why. I'm Joe Codde, and I am a transgender woman. As I reflect back on that horrible experience and wondering why it might have occurred, I tried to think, is this unique to me, or is this something that the entire transgender community experiences? And so, as a good academic, I started doing research. And what I found was that, according to a national transgender equality survey, 33%, 1/3 of all transgender patients have experienced poor treatment by their healthcare providers. That poor treatment could mean being denied care, verbally harassed. It even goes as far as they were physically or sexually assaulted. Of those transgender patients, 23% failed to return for follow-up care because they were fearful that they would once again be mistreated by their providers. As a transgender woman, I can now identify with this. I've had that experience. And as a 70-year-old transgender woman, I know I did not deserve to be treated that way. Was it because of who I've become, who I am, because I'm transgender? I retired from the MSU College of Education in 2014. During my career there, I worked initially training teachers, in-service teachers, on how to use and teach with technology. Later in my career, my work shifted, and I went from working in Michigan to working internationally, where I worked throughout the Middle East, North Africa, and Pakistan, working on training teachers, reforming teacher education. Then I retired. But now I'm back at MSU, putting the skills that I have in education, e-learning, and the experiences of my experiences as transgender woman, but also the experiences of those that I've learned about. My programs are focused on providing healthcare workers, not only at MSU, but across the state. I work and consult for hospitals, medical clinics, medical schools here at MSU and elsewhere, and nursing programs, and even community colleges with nursing programs. The continuing medical education, there we are. The continuing medical education program that I'm working here at MSU to create is an e-learning program for providers already in practice. It's through continuing medical education, and it's 3 workshops, each workshop 1 hour long, and includes 3 20-minute modules. The topics range from medical issues, mental health, and social issues, things that a provider needs to know about to be able to provide the basic care for a transgender or gender variant patient. When considering this topic and what should go into a program such as this, the question I asked, and we must ask, is why do our care providers treat us this way? Why do they fail to treat us with compassion, dignity, and respect? I believe that there's a lack of knowledge. And that lack of knowledge leads to a resistance to change. They don't know who we are. They don't understand us. They may very well not want to know who we are or understand us. We do know transphobia exists. And new research here at MSU with MSU faculty is showing that transphobia may be at the root cause of the poor treatment we receive. But I posit that to affect change, we have to better educate. And by better educating our healthcare workers, they'll be in a position to care for us in better ways. Now, regarding those 3 key words, let's look at how the transgender community defines the words. I went online in the last week or so, and in several transgender forums on Reddit. And I asked, what do these 3 words mean to you? Now, rather than try to recite them, I want to read their comments directly so I have them quoted correctly. Compassion. Compassion isn't something you know or learn. It's something you feel. Healthcare providers can show compassion by understanding who we are, what our health concerns may be. Compassion means treating us like they would treat everyone by asking us relevant healthcare questions and not talking down to us in a demeaning or pejorative way. Dignity. Dignity is related to conduct and asking questions related directly to our care and the immediate medical concern we came in to see them for. And it doesn't mean asking us questions about our genitals, our surgeries, our sex lives, or other inappropriate questions that may not relate directly to the healthcare concern at hand. And we also ask that you don't use us as a teachable moment for others in your practice area. There's no need to bring someone else in to show them what the issues are. Respect. Respect us by not relating every illness or symptom we have to our gender transition. Use our preferred names. Use our preferred pronouns. And if they're unsure, be sure to ask. Also, respect the fact that we may know more about transgender healthcare than they do, and that's quite often the case. The question now is, what is going to be the catalyst for change? A change that will improve healthcare for this diverse, vulnerable, and underserved population of patients. The catalyst is me. I am the catalyst. And the transgender community, we are the catalysts. We demand better care, equal treatment, and providers who know and understand our medical concerns. And now you, the audience, you can also be the catalyst for change by understanding these issues, the issues I've talked to you tonight about. You can educate not only yourselves, but you can also educate those who are in your social, academic, or professional communities. Sharing is an extraordinary opportunity to learn. You can offer the awareness and understanding that can make a difference in the lives of those who are transgender or gender variant. This may be in your own life. There may be folks here who are transgender, or you may be considering a transition. Or you may know someone. Might be a friend, a colleague, someone in your family, an aunt, uncle, brother, sister, son, daughter. Maybe it's a parent. Or maybe it's even a 70-year-old grandparent, as I am. Compassion, dignity, and respect. 3 words that, along with you and I, can make all the difference. Thank you very much.